According to the CDC, 9 out of 10 Legionella outbreaks were preventable with more effective water management. Hi, my name is Greg McKnight, Environmental Planner at the Washington State Department of Health. You've now watched the videos for creating your water management program team, the flow diagram with written description, and have taken a walk through your building to identify how water is stored and moves through your facility. The next step is to complete a hazard and risk assessment for your facility. Before going further, it may be useful to have your facility flow diagram available and the Washington State Department of Health Water Management Program template on hand to fill out during this video. Start your hazard risk assessment by identifying and documenting the people at higher risk to develop Legionnaire's disease and their locations in your facility. The first video in this series covers who at your facility is at higher or lower risk. Next, look at your water management program flow diagram and think about potential hazards and risk locations in your facility. You will need to create a risk assessment flow diagram for the areas identified. Potential hazard and risk areas for Legionella growth include temperature permissive conditions, stagnation of water in the pipes, lack of or lower than recommended levels of disinfectant in the water, areas where conditions for bacteria spread are more likely, such as decorative fountains, cooling towers, hot tubs, or ice machines. External hazards, such as construction, water main breaks, or low levels of disinfectant. An editable hazard and risk assessment flow diagram on the Washington State Department of Health website has icons for each of these situations. You can create your own icons or use the ones provided in the flow diagram. Place an icon at each hazard or risk location. Some locations will have multiple icons. As a healthcare facility, you will need to consider the potential for Legionella and other bacterial contamination. For example, if your facility has hydrotherapy tubs, think of the cleaning needed to ensure Legionella can't grow or the potential for the tub users to breathe in droplets. Respiratory equipment. If not cleaned properly or if exposed to inappropriate water types, there is a risk that bacteria could spread. Ice machines. People who have trouble swallowing could aspirate the ice and be exposed. The ice machine should be regularly serviced according to manufacturer guidelines. Here is an example using the editable hazard and risk assessment flow diagram. In this flow diagram, the municipal water could be potentially affected by a water main break or construction in the area. Make sure your water system has updated contact information for your facility staff so that they can notify you if there are any possible interruptions or breaches in your water system's infrastructure. In your building, sinks, showers may be affected by the hot and cold water distribution because there may be stagnation and the conditions for bacterial spread. There also may be low levels or no disinfectant levels in your water heaters, cooling towers, decorative fountains, hydrotherapy tubs, and recirculating water, among others. All of these should be noted on your flow diagram. Now that you have identified the potential hazards and risk in your facility on a flow diagram, you'll need to complete the risk rating table in the water management program template for each hazard or risk you identified and determine the appropriate control measure. You can add to the table or delete events that are not applicable to your facility. Some hazards require more than one control measure. For example, vacant rooms have the potential for stagnant water. This is considered a moderate risk because it can be controlled by proper flushing procedures prior to bringing the rooms back online. The hot water heating system has the potential to create an environment where Legionella can grow because of permissive water temperatures. This will be considered a moderate risk, but take appropriate steps to mitigate as needed. Results should be recorded on a temperature log sheet. This last step is extremely important. It will help you determine where control measures, which help reduce potential exposure to hazards or eliminate them, and monitoring is needed. We will discuss control measures and monitoring in the next video in the series. Identifying and managing these risks will not only help you manage potential Legionella in your water system, but also be prepared for other types of biological hazards that can contaminate the water. Remember, documentation is key in a water management program. As the adage goes, if it wasn't written down, it didn't happen. Thank you for taking the time to listen. I'm Greg McKnight with the Washington State Department of Health.